My name is Roger Lucien. I'm with Hammer Financial Group. With me is Colleen Mansmith. She's kind of our behind the scenes person. She's going to be, if you guys have questions, she's going to be answering the chat box. There's a limited amount that she can answer. So if we do not get to your question during this seminar, we'll absolutely make sure that we get you answers with follow ups to you on all the questions that you have. So I'm going to talk a little bit about myself. I've been with Greg Hammer, who started Hammer Financial Group about 20 years ago. Greg is a financial advisor. We have a financial advising firm in Schererville, Indiana. We are located on Indianapolis Boulevard in Schererville. We've been in business for about 20 years now. We do what's called a holistic approach to our financial planning, meaning we have a tax practice, we have a financial advising practice, we have a lawyer who does wills and trusts, and then for me, we do the Medicare practice. And so, really, what we fancy ourselves is if when you get ready to retire or retired, there's not much we can't help you with. And Medicare is my main focus, and that's what we're going to talk about today. So, with that, having wasted about 7 or 8 minutes getting the microphone going, I appreciate all of your patience with us. I think we'll go ahead and get started. Medicare has some rules that says there's some disclosures that I have to read to you before we get started and before we get into this. So I'm going to do that real quick. Hammer Financial Group is not connected with or endorsed by the United States federal government or Medicare program. This is a solicitation of insurance. I am a licensed insurance agent. A producer or one of our agents may contact you. We do not use all carriers, but we do offer about 30 plans from about 8 to 10 different carriers, companies in our area. To see all the plans in your area, you can, in your zip code, you can go to go to Medicare.gov or call 1-800-Medicare. With that, there's going to be this picture just shows us and shows us our Medicare team. From left to right, we have Beth, who is also one of our Medicare agents and runs our tax practice. Kimberly is our assistant who basically keeps us all in line. Then there's myself, and then there's Tammy Taylor, who works with me on the Medicare team and also works in our annuity department. So we have a pretty talented team that works with us on the Medicare side, and I couldn't be happier. So with that, one other a little disclaimer here, Hammer Financial is a broker, so we offer a variety of plans and companies. We can offer whatever company we decide to contract with. So we do offer Medicare supplements, Medicare Advantage plans, or Part C, which we're going to talk about, and prescription drug plans. We really do just about everything there is to do in and around the Medicare practice. We also offer ancillary products like drug plans, vision plans, and those sorts of things too. We're not going to get into those today, but we do offer all those plans. So with that, let's go ahead and get started. Um, so with Medicare, there are two parts to what's called original Medicare. There's Part A and there's Part B. We're going to talk about both of those pretty extensively. Part A, we'll talk about in just a second, but that's what's called original Medicare. So if you're either turning 65 or you're past 65 and have continued to work and you want to sign up for Medicare, you need to do that yourself. That's something that we can't help you with. We can kind of guide you along the way, but it's something that you can't walk into our office and sign up for Medicare. That happens through the Social Security office. And I know that for some people that sounds kind of strange to say that you sign up through Medicare through the Social Security office, but you do. So there's one of three ways you can do that. You can go on to the your Social Security portal if you have one set up online. If you don't, I would recommend you do that. Go to ssa.gov and set up a portal. The second way would be to call the Medicare office, and then the third way would be to go to your local Medicare offices. If you are thinking about going on Medicare, I would get that process started early. The Social Security offices tend to be a little bit behind and understaffed, and sometimes it can take you 2 to 3 weeks to get an appointment, and maybe even longer. So with this, let's talk about your choices when you go on original Medicare. There is, like I said, there's A and B. You can add prescription drug coverage to that. We're going to talk about that. And then there's the Part C, which is called Medicare Advantage plans. And some people call them replacement plans. They do have drug coverage included with them in some plans. Not all of them do. And again, if you were to come into our office for a complimentary review, we would go over those plans with you in detail. So with that, let's go ahead. One thing I like to point out is Medicare is about 59 years old. It's been around for quite a while. In July 30th, in 1965, LBJ signed that into law. And I always kind of joke in my seminars that it's really easy for me to remember because I was born in 1965. So Medicare is the same age as I am. And again, been around for a long time. A lot of folks don't understand that it has been around for that long of a time. So with that, I kind of alluded to this in the beginning. Let's talk about how what original Medicare works. There's Part A. If you're working, you're paying into the Part A trust fund. For the vast majority of the people in the United States, Part A is free. If you are the spouse that stayed home and did the hard work and took care of the children and took care of the house, then you would be free or eligible for free Part A based on your spouse's work history. So that's, I always tell everybody, think room and board. Think admitted into a hospital. That's a Part A claim. You must be admitted into a hospital. And if you see on the right side of the screen, there's a little box that pops up. It talks about the 2015 CHIP Reauthorization Act. And as part of that Reauthorization Act, there was two parts of that bill that affected Medicare. The first one was they took all the Social Security numbers off of the Medicare ID cards, and that's been done. The target date was 2019, and it happened prior to 2019. So anybody who turns Medicare age now, when you get your Medicare card, it's going to be a series of letters and numbers. It is not going to have your Social Security number on there. And for those who are already on Social Security, they received new cards that again took their Social Security number off it and replaced it with a random set of letters and numbers. The other change that was made was there were a couple of plans that have been phased out, Plan F and Plan C. Plan F was always the most comprehensive plan. It paid 100% of everything that Medicare didn't pay for, that was Medicare approved. The copays, coinsurance, deductibles that we're going to be talking about here in a little bit. However, if you turn 65 after January 1st of 2020, Plan F is no longer available to you, and now Plan G is the most comprehensive plan. And we'll get into that when we talk about Medicare supplements in just a little while here. So with that, let's just talk about Medicare Part A and what it covers. So Medicare Part A covers, you must be an inpatient um, hospital stay for 2 or more midnights. So it covers inpatient hospital care. It covers hospice care after, if you need hospice care, and it covers some skilled nursing care after a hospital stay. We'll talk about skilled nursing care and exactly how much Medicare covers. And then it covers home health care after a hospital stay as well. Those things would be skilled nursing care and home health care would be ordered by your doctor after an inpatient hospital stay. Part A is free for most people. I mentioned that earlier. When you are working, if you look at the Medicare deduction that comes out of your paycheck, that goes to the Part A trust fund. And again, that allows you to have free Part A. So Part A, when is a Part A claim a Part A claim? So when a doctor makes an official order which says you need 2 or more midnights of medically necessary inpatient hospital care to treat your illness or injury, and the hospital formally admits you. So here's where I usually make a distinction. Just because you go to the emergency room and the emergency room doctor calls your doctor and your doctor decides they want to keep you under observation for a night, and you go up to a room and you have a button to call the nurse and the TV, does not necessarily mean you're admitted into a hospital. You might be under observational. If you're under observational, that's a Part B claim, which has different copays and different deductibles, which we're going to talk about. So it's important to know if you're inpatient or outpatient. Inpatient Part A, outpatient Part B. Inpatient, then you would be eligible for skilled nursing care and home health care after that hospital stay, should you need it. In order for it to be a Part A claim, you must need the kind of care that can only be given in a hospital. The hospital accepts Medicare, and the utilization review committee of the hospital approves your stay while you're in a hospital. That happens behind the scenes. As far as hospital accepts Medicare, most hospitals, if not all, accept Medicare patients, and it's because of the baby boomers. Your generation, there are 11,000 people every single day that turn 65 in this country and become Medicare age eligible. So most hospitals, doctors, and facilities do accept Medicare at this point, just because they almost have to, because you're the lion's share of the business, that you're the people that are going to the doctor the most often. So with that, let's look at what Part A covers. So if you're in the hospital, again, remember, admitted into a hospital for 2 or more midnights, days 1 through 60, there is a $1,632 flat deductible. So whether you're in the hospital as an inpatient for 1 day or 60 days, there's a flat deductible of $1,632. If you're in a hospital longer than 60 days, let's say it's day 61 through 90, there's a $408 per day copay that you would pay that Medicare does not pay for. Now, here's generally when I'm in a one-on-one situation, I always tell people don't panic yet, because when we talk about supplementals, most supplementals, or the supplementals that you would look at, would help pay for these copays and deductibles and coinsurances. But if you're in a hospital longer than 90 days, which we realize is rare, but it does happen, Medicare, those days 91 through 100, Medicare has a they give you 60 lifetime reserve days. If you're using those lifetime reserve days, there's an $816 per day copay. So again, if you're using those reserve days, it's a $816 per day copay. If used up your 60 lifetime reserve days, then Medicare stops paying after the 90th day. If you're using your lifetime reserve days, then Medicare stops paying after the 151st day, as you can see here on the screen. So skilled nursing care, I mentioned skilled nursing care is also a Part A claim, and it must be preceded by a hospital stay for the for whatever you were in a hospital for. So let's say you were in a hospital, you live alone, you were in there for an extended period of time, and your doctor just feels like you need some skilled nursing facility stay to get back on your feet, to maybe to learn how to walk again, maybe for some rehabilitation services, whatever those things might be. Medicare covers the first 20 days. So days 21 through 20, Medicare covers at 100%. Days 21 through 100, there's a $204 copay that you would be liable for, and then Medicare would pick up the rest of it. And then days 100, excuse me, after the 100th day, Medicare stops paying, and that's when you or your family has to make some hard decisions. Do we be self-pay and stay in the skilled nursing facility, or do we go home? So again, the important part of this is the first 20 days are free, and then after the 100th day, that's when we got to make some decisions. Do we continue to stay in there as into the skilled nursing facility and be self-pay, or make other arrangements? So skilled nursing, let's talk about skilled nursing real quick. Skilled nursing benefits for skilled nursing facility care are covered only if your doctor prescribes the skilled nursing care. You need skilled nursing care every day, not just 5 or 6 days a week, unless it's for rehabilitation services only. Then you must get therapy every day. Services are offered. You were in the hospital for at least 3 consecutive days, 2 or more midnights. Remember that rule. Entered before you entered the skilled nursing facility, and you received skilled nursing care within 30 days after your hospital stay for the same condition. So it must be what you were admitted into the hospital for. And then the bottom part, your skilled nursing facility participates in the Medicare program, agrees with their doctor that you need type of care, provides a required level of skill nursing care, and then provides skilled rehabilitation services. All of those things, those bottom things, really are happening behind the scenes while you're in the hospital. Have a patient's advocate, and your doctor will be working with them to make sure that the facility that you and your family decide that you want to go to, number one, works with Medicare, and number two, is going to be able to give you the required care that you need. Again, the little pop up there on the right, bottom right, talks about that your doctor may order observation days while you're in the hospital. Those observation days do not count towards the 2 or more midnights that you need to be admitted into a hospital in order for Medicare to cover skilled nursing care. So just need to be aware of that, that those outpatient days do not count towards that. And those are questions that you're going to want to ask the doctor or your patient liaison before going to a skilled nursing facility. Have all the requirements been met? With that, let's just talk a little bit about how the numbers with skilled nursing care. Again, Medicare covers only short-term skilled nursing care, home care, skilled nursing and home care with no payments after 100 days. It does not cover custodial or intermediate the most common types of care. Somebody to stay home with your loved one for a few hours during the day, or if you need help in the evening. That is not what it's designed for. And in total, Medicare pays only about 13% of all long-term care costs. We do recommend, if you do not have any maladies or anything going on now, that maybe you look into skilled long-term care insurance. Long-term care insurance is not nearly the way it used to be. So we do have a specialist in our office who can help you with that. If that's something you're interested in, just let us know, because it does tie in with your Medicare coverage, and it is something that you want to make sure that you have if you're interested in that. So home health care. Home health care works very much the same way as skilled nursing care. Medicare pays for benefits for home health care only if you need part-time skilled nursing care, physical therapy, or speech therapy. You're confined to your home. Your doctor prescribes your home health care and sets up the plan, sets up the program with you, and your home health care agency is Medicare approved. Again, you're going to hear me say this probably a few times, but because 11,000 people every day are eligible for Medicare. There are currently 70 million people on Medicare. Most home health care agencies are designed for people who are on Medicare, but your doctor and your patient liaison at the hospital would make sure that those are all set up in the proper way. To be homebound, So you must, in order to get home health care, you must be homebound. It says the requirements are you have trouble leaving your home without help, like using a cane, walk, or crutches. You can leave your home for religious services, adult daycare, and your doctor's appointments. But for the most part, you must be homebound in order for Medicare to pay for home health care. The other thing is to be aware of is if you're getting home health care, Medicare is going to continue to approve that as long as you're improving. Once you have plateaued or peaked or gotten to a point where you're really not getting any better, the home health care agency is obligated to report back to Medicare that you've sort of hit a wall or hit a plateau and not going to get any better. And those services could be cut off. But always speak with the nurse that's coming into your home just to make sure that you're aware of what your rights are. Again, I mentioned this just a second ago. There are more than 70 million people currently on Medicare, and the estimates that I read are by 2035, there's going to be about 120 million people on Medicare, and possibly even more. So very, very many on large population part of the population are currently on Medicare, and that's going to continue to get larger and larger. And that is because of you guys. It's because of the baby boomers. So with that, that's part A. Part A is pretty straightforward. Again, just think room and board, skilled nursing care, home health care, must be admitted into a hospital. So with that, I'm going to talk about Part B. Part B is a little more complicated. Part B basically covers everything from doctor services, outpatient hospital services, medical services and supplies. And let me run back here real quick. So medical services and supplies. It also covers IV infusions. It covers any medications that you would get in a hospital, in a doctor's office, or in an infusion center. So if you have Remicade or chemotherapy or something like that, those would be a Part B claim, not a Part D claim in drug coverage that we're going to talk about later on down the road. Those would be covered under Part B. So with Part B, unlike Part A, there is a there is a premium. So you can see on the far right of this chart, and this is a little bit cumbersome, and I'm not going to read the entire chart to you. This is available if you're interested in this chart. We can get it to you, but on the far right, you'll see where it says you pay, and the first is the base premium for Part B, and it's $174.70 a month for 2024. If you're collecting Social Security, that 174.70 will come out of your Social Security check. If you're not collecting Social Security, then Medicare will bill you quarterly for the 174.70 times 3. So each quarter you'll get a bill from Medicare. So let's say you've decided to go on Medicare, but you've also made the decision to delay your Social Security benefit to let it grow. You're not going to collect Social Security yet, but you are going to go ahead and go on Medicare. Then you're going to get billed directly from Medicare instead of that premium coming out of your Social Security check monthly because you're not collecting it. So the next part about this chart is a little bit confusing. What I generally look at is if you'll look at the joint right in the middle, the second column, the joint tax return. So if you are married and you file a joint tax return, there's a thing called an IRMA, an income related monthly adjustment amount. It's an acronym for IRMA. Again, income related monthly adjustment amount. So this chart basically lays that out. So if you look at that second column where it says joint and you go down, if your adjusted gross income, if you're a married couple and you file a joint tax return and your adjusted gross income was more than 206,000 in 2022, I'm going to explain that in just a second, but was more than 206,000 and its adjusted gross income on your federal tax return was more than that, you're going to pay more for your Part B based on where you fall there. So I'm not going to go through the entire chart. You can see if you made more than that in 2022 and why 2022. So Medicare sets the Part B premiums in the December of the previous year. So in December of 2023, they set the 2024 premiums. So if you think about it, we are just now getting ready to do our 2023 tax return. So the only income numbers that the federal government had to look at was your 2022 tax return. So there's always a 2-year lag when they figure out your Part B premium. So that's why that is. So for 2025, they're going to look at your 2023 tax return and so on and so forth. So for 2024, they're looking at your 2022 tax return. And again, depending on where you fall in that chart, then you'll pay a higher Part B premium. However, there is a remedy for that. If in 2024 you're going to be retired and you're going to make less income, there's a form called an SSA, Social Security Administration. So it's an abbreviation, SSA-44 form. We have those. If that's something that you need help with or you need further explanation, please reach out to us. We'd be happy to help you with that. But it's an SSA 44 form, and it's an appeal form. And basically, what it says is I am not going to make as much income in 2024 because I'm retired for whatever reason. And there's a list of reasons why you can appeal. But let's say it's retirement, and I'm not going to make the $206,000 adjusted gross income. Don't look at you're asking Medicare to not look at your 2022 tax return. You're asking Medicare to look at what you're going to make or what you're going to estimate your adjusted gross income is going to be in 2024. Again, if you have questions on that, please reach out to us. We can help you with that. We have all those forms that we can send to you, and we can also give you a little more detailed explanation with your situation because everybody's situation is different. Um, Medicare Part B also has a deductible. Remember, I mentioned that $1,632 Part A deductible, and then those per days if you're in the hospital longer than 60 days. One thing I failed to mention on that is those deductibles are per benefit period, meaning if you're in the hospital, get admitted to a hospital several times throughout the year, those deductibles could come into play several times. If you look at this page with the Part B deductible, and that is that first line underneath that chart, that eye chart, where it says $240 deductible. So for Part B claims this year, Medicare has a one-time per year $240 deductible. Now, anything that's preventative is not subject to that deductible. So if you have a colonoscopy, a mammogram, a prostate exam, your yearly wellness visit, if you're brand new to Medicare, you're welcome to Medicare wellness visit, not subject to that deductible. But let's say you go on Medicare and the first thing that you have for the year, you go to the emergency room, they do a bunch of tests, you're going to get a bill for $240. That is that is the Part B deductible, unless you've grandfathered in and you're able to get a plan F that covers that Part B deductible. We're going to talk about that more in just a second when we get to supplementals. But after that $240 deductible, all Part B claims are 80/20. You can see at the bottom there or in the middle there where it says 80 or 20% of all Medicare approved expenses after the deductible, which is the $240. This is what you're liable for. And then mental health visits come with a 35% coinsurance. Regular visits, 20% coinsurance. Mental health visits, 35% coinsurance. So all costs for services and supplies not included on Medicare's list of covered items. So what that means is if it's a list of covered items that Medicare approves, then you're going to owe 20% of that. Again, the supplemental that we're going to talk about or the advantage plans that we're going to talk about also are going to help you cover those costs, with the exception of the $240 deductible, unless you're eligible for a Plan F, which again, that is you would have to have been turned 65 prior to January 1st of 2020 in order to get a Plan F. So this chart just shows what things that are covered by Part B, services in the hospital, or doctor services in the hospital, in your doctor's office from your doctor's nurse, any Medicare approved medical or nursing facility treatments, at home treatments, assistant surgeon fees, diagnostic tests, administered drugs, anesthesiology fees, immunizations, preventative services. I'm not going to go through the rest of these, but you get the hint. You get the gist of it. Emergency room visits. To me, the next chart is a little more important. So these talk about what is covered by Medicare, and probably one to be that is important would be on the far right would be ambulance rides. Those are covered by Medicare, of course. Ambulance rides from your home to a hospital if you need an ambulance ride, of course, is covered by Medicare. Things that are not covered by Medicare, and some of these are misconceptions because of some of the commercials out there for Medicare Advantage plans, and people get a little bit confused. But things that are not covered by Medicare are dental care. A traditional Medicare Part A and Part B does not cover dental. It does not cover acupuncture, oral surgery, routine foot exams, chiropractic services, except for manual manipulation of your spine. Vaccines covered by Part D. So if a vaccine is covered by Part D, then it's not covered by Part B. In the middle, cosmetic procedures that are not medically necessary. There are cosmetic procedures that are medically necessary. So if a lady has a mastectomy, needs reconstructive surgery, by all means, that's covered by Medicare. It would just be things that are elective. Cosmetic surgeries are not covered by Medicare. If they're medically necessary, then they would be covered by Medicare. Lab tests not medically necessary. So a lot of folks, when they have something serious happen, like to go to Chicago Northwestern or maybe Mayo Clinic or maybe some of these clinics that Cleveland Clinic that are go above and beyond what a normal hospital would do. There are some lab tests that are not. Medicare doesn't consider medically necessary and they don't pay for them. If that happens and you have a test or a procedure that your doctor thinks you need, that they have not gotten approved by Medicare and Medicare does not approve it, that facility or doctor is going to let you know that this test or procedure is not covered by Medicare, and then you would be liable for those costs, or you could say you do not want to have that procedure done. And then on the right, dental plates, orthopedic shoes, first aid supplies, self-administered drugs, eyeglasses, and hearing aids. There is one exception to that, and that's eyeglasses. Medicare will pay for one pair of eyeglasses after your first cataract surgery. That's the only exception. Again, don't confuse that with Medicare Advantage plans, commercials that you see on TV. We're going to talk a little bit about those. Those do have some dental, vision, and hearing embedded in those plans. So with that, let's go ahead and talk about, I kind of like to throw some facts and figures into my seminars. So one I think is interesting, the 2020 fiscal 2023 Medicare official budget was $747 billion. So think about that. In this country in 2023, on roughly 70 million people, our country spent $747 billion in Medicare costs, and we have surpassed 700 billion in the past 2 years. So think about it when I mentioned that by 2035, we're going to have close to 120 to 130 million people on Medicare. You can imagine what that's going to do to that budget. So just a little caveat there. Just like to mention, it's serious money that our government puts into Medicare. It's a big budget, and it is very comprehensive. So with that, let's talk about Medicare supplement policies and how they work. So with a Medicare supplement policy, they're basically what they do is they're designed to fill in the gaps of Medicare. So if you've heard the term Medigap policy, supplemental policies, secondaries, all birds of the same feather. They all mean the same thing. And why Medigap? Why did they come up with that term? Because it fills in the gaps of Medicare. Supplemental, obviously, just supplements Medicare, helps cover those gaps that we talked about earlier, the copays, deductibles, and the coinsurances that we talked about with Medicare Part A and Part B. The choice of plans determines those gaps covered. And we're going to talk about those plans in just a second. And then also to help with gaps in original Medicare, there's prescription drug coverage or Part D. We're going to talk about that at the very end. The art chart at the bottom here underneath the blue talks about how Medicare supplement plans are priced. But I'll tell you that the vast majority of them, if not all of them, except for one in our area, are priced by attained age. And all that simply means is the older you get, the more you pay. There is one company that does issue age. However, they have a discount and they take part of that discount away each year. So effectively, they have a price increase each year. So they have an age increase. Most plans have an age increase and then a price increase. One thing to know about Medicare supplement plans is they are good anywhere in the country. If you have a Medicare A and B and a Medicare supplement plan, you can see any doctor anywhere in the country as long as they accept Medicare. So if you're traveling, these travel very well with you. And they're very comprehensive coverage, although the coverage does vary by plan, which we're going to talk about in a little bit. And then at the very bottom, you can see here, I'd mentioned this earlier, but Plan F and Plan C have been phased out. Those are the two that cover the Part B deductible, which if you remember for this year is $240. All plans are now, for anybody who turned 65 after January 1st of 2020, no longer cover that $240 deductible. So whatever supplement you would have, you would be on the hook for that first $240 each year. And that does change a little bit every year. It went up a little bit this year to $240. So with that, this chart just talks about what the Medicare supplement policies that are available. You can see there's two holes there in the middle. Those were Plan F and Plan C. Those have been phased out. Again, if you do fall into those categories where you're still eligible for those plans, we would offer those to you and kind of show you the differences. But basically, if you look in the middle where it says Plan G, Plan G covers everything that Medicare doesn't pay for as long as it's Medicare approved, the copays, the deductibles, and the coinsurances that we talked about, with the exception of, you can see the hole towards the bottom, the third column from the bottom, where it says Part B deductible. So a Plan G does not cover that Part B deductible of $240. As you go down in coverage, as you go out from the middle towards the outsides, you go down in coverage, you also go down in price. So as of right now, for anybody who turns 65 after January 1st of 2020, Plan G is the most comprehensive plan. When it comes to pricing for these plans, we can't talk about that today, but pricing for these plans are logged with Medicare generally a year in advance. Whether you use an agent like me, you buy it directly for the company, or you find somebody that you trust that can help you through this process, through this Medicare process, the plans prices are what they are. They don't change by getting assistance from an agent like me. So I always tell people in my seminars, find somebody that you trust, whether it's us or not, but find somebody that you trust that can help you navigate this because it is important. And you're making life-changing decisions, and you want to make sure you make a good, educated decision. You also want to make it sure that you're meeting with somebody who represents all the plans, all the types of plans that are available to you, so that you make a good decision based on your situation, not based on your neighbors or your nephews or your uncle, or your brother or your sister. Everybody's going to give you advice right now, but what I'm going to tell you is just make sure that you're making decisions based on your situation alone. Okay. Couple more things about this chart I'd like to point out. If you see the asterisks, there are a few different little caveats to there. Plan G has a high deductible plan, which for this year has a $2,800 deductible. Um, the very last column or row, I should say, at the very bottom where it says foreign travel emergency benefit, for the plans that have that 80%. A lot of people after they retire, they want to go, they want to travel, they want to be able to go outside the country. So if you're traveling outside of the country, there is a foreign travel benefit if you have a supplement, no matter what company it is. But if you have a supplemental, and in this case, let's just use a plan G, you can say that 80% is at that bottom. It's a $50,000 lifetime benefit. There's a $250 deductible, and it's paid at 80/20. So again, a $250 deductible, and it's paid at 80/20 up to $50,000. What it's really designed to do is to get you healthy enough to get you back on United States soil so that you can be covered under Medicare. So that's what that benefit is all about. On the far right, a lot of agents now are talking about Plan N because it is a little bit cheaper than Plan G, which is perfectly fine. It's a great plan. However, just understand that there are some differences with Plan N, and you can see the three asterisks there. So with the Plan N, just understand that there could be a $20 copay for an office visit. There could be up to a $50 copay for an emergency room visit, and then it also does not cover the Part B excess charge, which is the second to the bottom row. Let's talk about that real quick. So right now, the only plan that covers that Part B excess charge is a Plan G. So what is a Part B excess charge? What does that mean? So there are doctors and facilities out there who accept Medicare patients, but they don't accept what's considered Medicare assignment. And all that simply means is what Medicare has agreed to pay for a procedure. So if you've ever looked at an explanation of benefits, you had a hospital stay or a hospital bill, and you see that the hospital charges you or the doctor charges you an exorbitant amount of money, and then your insurance company says, no, this is our allowable, and then you might owe the difference. With Medicare, they do the same thing. They tell the doctors and the facilities, no, this is our allowable. So whatever the allowable is, if you don't have a Plan G and you have one of the other plans and a doctor does not accept Medicare assignment, now this is rare, I will admit to that, but there are doctors and facilities out there, they're very rare, but there are out there that don't accept Medicare assignment. In that case, they can charge you up to 15% of the Medicare allowable. So whatever that Medicare says, this is what we're willing to pay for a procedure. If a doctor doesn't have a contract with Medicare saying we're gonna agree to that payment, they can upcharge you 15% of that Medicare allowable. If you have a Plan G, it's the only plan that covers that 15% excess charge. So just be aware of that. Okay. So with that, let's go ahead and move on. We're going to talk a bit about Medicare Advantage plans now. These are a little bit tricky. They are There's a lot of different names for those. Some people recognize them as Medicare Advantage plans. They're also called Part C. They're also called replacement plans. So a lot of people in the medical field refer to them as replacement plans. And the reason for that is if you're on a Medicare Advantage plan, if you sign up for a Medicare Advantage plan, technically you're not on Medicare Part A and Part B anymore. And what I mean by that is if you're on an Advantage plan, the bill goes to that company. It does not go to Medicare. So it's just handled a little bit differently. It's much like the care that you had when you were working. Um, Generally, there are PPOs and HMOs. So let's talk about them a little bit. They create an alternative to original Medicare. Again, technically, you're not on an original Medicare. Just for This is a question I get a lot, and just for your information, if you have a Medicare Advantage plan, you still pay your Part B premium. So that 174.70 that I talked about when we were talking about Part B, or a higher amount if you're a higher earner, you still pay that Part B premium, even if you choose a Medicare Advantage plan. However, they may have lower costs than original Medicare for some things. They usually have copays and coinsurances. In many cases, they have in and out of network providers. That would be the PPOs versus the HMOs. A PPO is going to have an in and out of network provider. If you choose an HMO, then you're going to have to stay in that network. Okay. They're available on a county by county basis. They're literally different in every single county. Um, Most companies offer the same plans county by county, but the benefits can be different literally when you change from one county to another. They must offer coverage to at least match original Medicare, meaning their average payments must average what Medicare would pay for a procedure. But there are different features that they offer, and that's what you're seeing for commercials for on TV. Some of them have dental coverage, some have vision coverage, some have an over-the-counter benefit. A lot of them have what's called silver sneakers. A lot of people are interested in that. Basically, it's a gym membership. And then there's some other features that they've added to the Medicare Advantage plans. So they can be very pertinent and very good for people in certain situations. Just make sure that if you're talking with an advisor like me, an agent like me, that they do offer all the plans, because you want to make sure that you are experiencing or looking at all the plans that are available to you, so you make your very best decision. And then again, at the very bottom, a lot of the Advantage plans do have prescription drug coverage embedded in it. Not all of them do. There are some Patriot plans out there, or VA plans out there that are strictly designed for people who are veterans who strictly use the VA, and those are a little beefier plans. They don't have drug coverage because you would get your meds through the VA, but they have a little beefier plans. If you're in that situation, we have a couple of really good plans that in our area that I would definitely suggest that you take a look at. So with that, we're going to go ahead and move on to uh, the enrollment periods for Part C. So again, I mentioned it when I first started talking, when you're first eligible for Medicare is when you're 65, or if you're going to work past 65, then when you leave or lose your group coverage. Medicare has Part C has much the same enrollment periods. There's the initial enrollment period, which is the 3 months before, the 3 months after when you turn 65, or when you first go on Part B. If you sign up 3 months before, it's not going to be effective until the month that you turn 65. And by the way, you're always eligible for Medicare the first of the month that you turn 65, unless your birthday is the first of a month. So let's say your birthday is May 1st, then you would be eligible for Medicare April 1st. Okay. So just keep that in mind. If you're born in the first of the month, you're eligible the prior month. But if you're born in the middle of the month, your Medicare eligibility is actually the beginning of the month that you turn 65, or the beginning of the month when you're going to be leaving or losing employer coverage. And then there's some other enrollment periods for Medicare Advantage plan. One that you hear about a lot is AEP. That's the one at the end of the year. It starts in October. It's actually October 15th through December 7th. But the reason you know that's around is because you'll start seeing all the commercials on TV. You can't hardly get away from them. So that goes from October 15th to December 7th. What that allows you to do is look at your Medicare Advantage plans and decide if it's right for you. A few years ago in 2019, Medicare brought back what they called the OEP. It was used to have it years and years and years ago. They brought it back. It's the open enrollment period, and that happens between January 1st and March 31st. What it's designed for is basically if you've been either misled or you accidentally signed up for the wrong Advantage plan for you during the annual enrollment period, that October 15th through December 7th, prior to 2019, you were stuck in that plan for the rest of the year. So because of all of the advertisement out there, the phone calls, the stuff you get in the mail, some of it can be misleading, some of it can be confusing. A lot of folks were signing up for plans that just didn't work for them. Maybe their doctor wasn't in the network, their medications were too much, the hospital wasn't in the network, that they weren't able to go to the to providers that they wanted to. So Medicare recognized that problem and brought back the OEP and said during from January 1st through March 31st, you can have a do-over or an oops. You can change your Medicare Advantage plan now. So there's some very strict rules around that. So make sure you reach out to an expert who knows and understand what the rules are and when you can and can't do that. But again, that goes from January 1st to March 31st. And then there are some special enrollment periods. I'm just going to talk about a couple of those. There are a lot of them. The first special enrollment period I mentioned a second ago, let's say you're not going to retire at 65, so you don't go on Medicare, you stay on your group insurance. And then later on down the road, you decide you're going to retire and you sign up for Medicare. That triggers a special enrollment period because you're past your initial enrollment period, you're past 65. So that special enrollment period basically is triggered when you're going to leave or lose your employer coverage. And what that does is give you the ability to sign up for Part A, Part B, a supplemental, a drug plan, an Advantage plan, whatever you choose, with no penalties and no questions asked, no medical questions. So it's basically a do-over from your initial enrollment period because you have to have creditable coverage in order to be eligible for that. Otherwise, you should have signed up back when you were 65 if you don't have creditable coverage. If you don't do that when you have creditable coverage, then it's a penalty. But again, if you're working and you have group coverage, all of those coverages are credible. Since Obamacare became the law of the land, all coverages that group healthcare plans offer must be credible through the federal government. There are a handful of exceptions with prescription drug coverage. If you have a prescription drug plan that's not considered creditable, that plan has to let you know prior to you turning 65, and then you got to make a decision whether or not you want to sign up for a Medicare prescription drug plan so that you don't have a penalty down the road. And that would be something that we could help you with as well. It just talks a little bit about on the right side there about that OEP. The next chart talks about what you can and can't do during the OEP. And basically what it is you can switch from one Advantage plan to another that might work better for you. You can go back to original Medicare and get a prescription drug plan. However, it does not guarantee that you can get a supplemental. So what we recommend is if you're in that situation, number one, get advice from a professional. But what you want to do is make sure that you're looking at the supplemental to make sure you can get approved for it prior to making that change. Again, it's a little bit confusing of what you can and can't do there. Just make sure you reach out to a professional if you're in that situation. Okay. So with that, that's part C, again, Medicare Advantage plans. We're going to go ahead and roll right into the prescription drug coverage part of this. So part D is the prescription drug coverage. It is probably one of the most difficult parts about what we do, but it's also probably one of the most crucial parts about what we do. We've seen folks paying way too much for their prescription drug plans because maybe they bought it 10, 15 years ago and they've never changed it. They've never looked at it. And now all of a sudden they're paying way too much for a plan that they really don't need. They might need a lesser plan. So it's really, really important that you review your drug plan every year. We do that for our clients here. And it is very, very important. But let's go ahead and jump into it and talk about how they work. Prescription drug plans or Part D provide assistance with prescription drugs. Coverages vary by company and offering by plan. Plans are not offered by Medicare. They're sold by insurance companies. A lot of people will say, well, I'm going to get a Medicare prescription drug plan. Now, Medicare does oversee the drug plans, but they do not offer drug plans. They're sold by insurance companies, all the big companies that you had heard of, and probably some smaller ones that maybe you haven't heard of. Formularies can be different with each plan. Copays and coinsurance and deductibles vary by plan. Premiums vary by plan, and many companies offer more than one plan. As a matter of fact, most companies offer 3 plans because that's the maximum that Medicare will allow them to have within their stable is 3 plans. We do those reviews. If you were to come in for a consultation, then we're going to be able to, based on your medications, plug those into the finder that we have, the plan finder that we have, and suggest what plans might be right for you, and then kind of go through the plans and look at the ins and outs, so that you can figure out what's the best plan for you in your situation. Again, I'm going to warn you, just like I said earlier, don't make decisions based on your neighbors or your cousins or your friend's best friend. Make decisions based on what's right for you. And again, why it's important to talk with an agent who knows what they're talking about, who can help you walk you through this process and really just educate you. We want to be educated so that you're making the best decision for yourself. Um, Enrollment periods are the same as the Part C, the Medicare Advantage plans, with one exception. Medicare Part D plans do not have that open enrollment period. So what that means is whatever plan you sign up for during the annual enrollment period, and after December 7th, that is the plan that you will have for the following year. Period. There's a couple of exceptions to that. If a plan gets sanctioned by Medicare, which is rare, but if that happens, then you would get a letter stating that you could change to a different plan with no questions asked. Or if you move outside of your plan area, then you would get a letter stating that you have a 63-day window to change your drug plan. So there's a handful of other special enrollment periods. If there's a disaster in your area during the open enrollment period, or during before you turn 65 and you're just not able to get that taken care of, occasionally we'll have disaster relief special enrollment periods that might apply to our area. Illinois had one last year. Of course, the southern states have had those, and we also had it during COVID. We had some special enrollments because people just weren't able to get out in a timely fashion to be able to sign up for the drug plans, and Medicare did not want to hold them accountable for something that was out of their control. So there are special enrollment periods, but in general, you're going to need to sign up for one either when you turn 65, when you sign up for Part B, and you definitely want to review that every year at the end of, or excuse me, during the AEP, which is October 15th to December 7th. So with that, let's talk a little bit about how prescription drug plans work. They also have the IRMA, the income related monthly adjustment amount. I'm not going to repeat myself too much on this, other than to say basically the same thing. They're going to look at your 2 year ago tax return unless you appeal it with that SSA 44 form. But what happens is you're going to have a premium for your plan. And then if you're a higher earner, you're going to pay more based on the chart that you see, depending on where you fall in that chart. So let's just say that you're a married couple. You filed a joint tax return in 2022. You made $250,000. You're going to pay your premium for your plan plus an additional $12.90 that's going to go to Medicare as that part of that IRMA, that income related monthly adjustment amount. And by the way, that is each. So if you're a couple, and if you incur a penalty, you're both going to pay the penalty. It's each. Okay. Everything with Medicare is you're on your own. It's each. If you do not sign up for a Medicare prescription drug plan, I get this question a lot. Do I have to have a drug plan? I don't take any medications, or I take very little and I get them through GoodRx, or I just self-pay for my medications. Medicare doesn't force you to sign up for a drug plan. However, and it's a little bit hard to read, it's at the bottom underneath of this chart. If you don't sign up for a drug plan when you're first eligible for one, and you don't have creditable coverage through an employer or through the VA, then you could potentially be hit with a penalty. So the penalty is 1% for every month that you don't have credible coverage when you should have, okay, when you don't have credible coverage. So let's say that you go 10 months, you turn 65, you didn't get a drug plan. 10 months later, you decide you want to sign up for a drug plan. There's a couple of penalties. The first one is monetary, that 1%. So the 1%, Medicare is keeping track of how many months you didn't have coverage. So let's say you go 10 months, you're going to pay a 10% penalty. You're going to sign up for a plan, you're going to pay a 10% penalty. And you can see the average plan this year is $55.50 a month. That's the average throughout the entire United States. All of the drug plans that are available in the United States, you're going to pay if it's 10%, you're going to pay a $5.50 penalty every month for the rest of your life. Once you incur the penalty, it never goes away. So what we do recommend is when you're in that situation, is just sign up for a cheap drug plan. It might not be necessarily the perfect plan for you if you have VA benefits or something like that, but you're going to want to sign up for a plan that's going to be able to help you with those drugs, and then also you wouldn't have a penalty down the road. The other penalty, I mentioned there's two penalties. So the second penalty would be, let's say that you turn 65 in February, and you didn't sign up for a drug plan, you're past your initial enrollment period, the doctor put you on a very expensive medication and you need a drug plan and you come to me, you cannot sign up if you're past your initial enrollment period until the open enrollment period, which again, the annual enrollment period, which starts October 15th through December 7th. And then that plan doesn't go into effect until January 1st. So the bottom line is just make sure that you're getting all the pertinent information. You're making a good decision. If you decide to opt out of drug coverage based on your situation, that's okay. Just understand what the consequences are and make sure the agent that you work with explains that to you so that uh, you have that knowledge to make that decision. So how does a drug plan work? So back in 2005, Medicare started to develop the prescription drug plans. And so this year, they have the base deductible is $545. All that means is that's the highest deductible a Medicare prescription drug plan can have. So there's four periods to a Medicare prescription drug plan. There's the deductible phase, there's the initial coverage phase, there's the coverage gap or donut hole, if you've heard of that, and then there is the catastrophic phase. So the way they work is at the beginning of the year or at the beginning when you first sign up for a prescription drug plan, Medicare is keeping track of how much your Medicare prescription drugs cost. Once you've met that $545 deductible, and by the way, on most plans, that $545 deductible is only tiers 1 and 2. The cheaper medications are not subject to that deductible. Not all plans, but most plans. And then there are some plans that don't have a deductible at all. And then there are some plans who have a lower deductible. So again, when you come into our office, we're going to plug in your medications. We're going to be able to tell you what plan is best for you. And then we're going to be able to tell you what the deductible is, what medications you have that are subject to that deductible. But after that deductible, then there are just copays. It's your initial coverage limit or coverage of the plan, and you're just going to have copays for that, whether it's a $0 copay, a $5 copay, a 25% coinsurance, whatever it might be, depending on your plan. That's your initial coverage phase. When you hit the donut hole or the coverage gap, depends on how much your medications cost. So in 2024, and there is a misprint here, it says 2023, but in 2024, if your medications total costs end up being $5,030, that's the total cost of the medication, not what you pay, but the total cost of medication. You go into what's called the donut hole, the coverage gap. If you're in the coverage gap of the donut hole, you pay 25% of the cost of all of your medications. So Medicare stops paying, the drug plan stops paying. Medicare is going to pay your 75% of the cost of the drug plan or of the drugs for brand names and 75% for generics, and you're going to pay up to 25% of the cost of your medications while you're in the coverage gap. Then there's the catastrophic phase. The catastrophic phase is a little bit cumbersome and a little bit hard to explain, but basically when your out-of-pocket cost, including what your uh, reductions are in the medications, total $12,447, you go into what's called the catastrophic phase. At that point, you pay 5% of the cost of your medications, but it is limited this year. After $8,000, then your medications are free when you're in the catastrophic phase. So bottom line is on this is when you come in, if you give us, if you meet an agent, if you, especially with one of our agents, so we're going to plug in your medications and we're going to be able to give you a printout of when to expect all of these periods. If you're going to hit the coverage gap, if you're going to go to the catastrophic phase, how much your medications are going to cost you month by month by month, depending on what phase you're in of the plan. So we'll be able to walk you through that if you come in and meet with us. Just also, I want to mention here, I think I mentioned it earlier, but I want to mention our Medicare consultations are always free. So to come in and visit with us and just see if, I always tell people, see if you like us, see if we like you, see if we're a fit for each other. Make sure that we're or a real business. We have a business. We know what we're doing, and we tend to like each other. We're a good fit for each other. At that point, those consultations are free. When we do applications down the road, I get paid by the insurance companies. It does not change what you pay. There's never a cost for our services on the Medicare side. Financial side, different story, but just Medicare side, we never charge fees for our Medicare services. We get paid by the insurance companies. Again, I want to reiterate, it does not change what you pay. Those fees are told to Medicare a year in advance, so they never change whether you use us or not. I'm going to preach again. Find somebody that you trust. Find somebody that you look in the eye that can educate you with all the decisions that you need to make, because it's just pretty straightforward. But if you're new to the Medicare, it can be a little bit confusing, and you want to find somebody that you know you can trust. So we're going to help you that with the drug plan. We're going to give you printouts of exactly what to expect throughout the year. Now, if your medications change throughout the year, obviously that's going to change, but we're going to give you a baseline of your medications and what to expect. And then each year after, we're going to review your drug plan with you. And we have a whole process for that. Our team is very, very good at that. I have a couple of assistants who are outstanding. So our team is great at that follow up during the annual enrollment period to help you make sure that you're on the right drug plan for the following year. Because again, very, very important. You could be on the wrong drug plan. It could cost you hundreds, if not thousands of dollars. So with that, I always like to end with this chart, just to simply say that the two parts in the middle, the part A and the part B in purple, are what you need to do with the um, with the with the Social Security office. Okay, I cannot sign you up for Part A and Part B. I can help you. I can tell you what to do, but basically, that is, you're going to reach out to the Social Security office, whether it's a phone call, an in-office appointment, or through your Social Security portal. Okay, so you can see on the left of your screen there, we do have a complimentary consultation. If you want to click there to schedule an appointment, do that. Colleen will reach out to you afterwards to get you on one of our advisors' schedules. But basically, what that's for are all the things that surround those purple, right? The Medicare Advantage, the prescription drug, the supplemental, Medicare Advantage without drug coverage. Find out what the benefits are. Find out what all the supplemental plans are. Which one's right for you? What's the right drug plan for you? Do I go with Medicare Advantage? Do I go Medicare supplements? What are the rules around those? What can I and can't do? What we recommend is, if you're thinking about retiring, just come in and sit with us. Even if you don't retire, develop that relationship with our company so that you have a go-to person. So when the time is right for you, you are ready to go. Excuse me, I've been talking too long. So we just want you to develop that relationship, but ideally 6 months ahead of time. If you know what your retirement date is, you come in, you meet with us, we lay out the basics. 3 months ahead of time, we would like to meet with you to reiterate those plans, make sure you're still on the same page, you make your final decisions, and then we can do applications then if you have your card. Or what I really like is our drop dead minimum would be a month ahead of time prior to the effective date. We would want to see you to make sure we can do those applications. So that we know that you have your cards in your hand, you understand what the plan is, and you understand how to access your care. So 6 months, 3 months, 1 month. If you're before 6 months ahead of time and you want to come and meet with us, we're all for that. We're hallelujah. Come in and meet with us, see who we are, see what we're about, see if you like us, see if there's any of our other services that you could take advantage of. But Medicare, it's never too soon to start planning. We encourage you to start doing that right away. With that, I'm going to run through our team real quick again. There's myself. I do run the Medicare division, but I do have a fantastic team that work with us. We've got Beth to your left there. Then Kimberly in the middle is our assistant. She also sells our dental and vision plans. Then there's myself, and then there's Tammy, who works with us in the Medicare side as well. And Tammy also works in our annuity business. So she's a very, 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 very good Medicare agent. So we have a very good staff who can help you with any questions, concerns, thoughts that you need. If you'd like to set up a phone call or an in-office appointment, we prefer in-office appointments. There's some paperwork that's going to have to come with this. So I'm going to talk about that in just a second, but let me go ahead and read this page first. It just says that Hammer Financial is not connected with or endorsed by the United States federal government or the federal Medicare program. This is a solicitation of insurance. A licensed agent or producer may contact you. We do not use all the plans in our area. However, we represent most plans in our area. We represent over 30 plans and at least 8 companies. If you're interested in all the plans that are available in your area, you can go to Medicare.gov or call 1-800-MEDICARE. With that, I would just like to say thank you. We are not so this just talks about the forms that we need to have filled out prior to an appointment. So we do need some intake forms. There's a form called a scope of appointment form it's a Medicare necessary form that prior to us giving you specific information, that form has to be filled out and signed for you and dated 48 hours prior to an in-office appointment or an in-person appointment. That allows us to give you specific information. And the reason is Medicare wants there to be a 48-hour cooling off period between our initial contact and then going over those plans with you so that you have a chance to digest that information, and then we can start talking about specific plans and pertinent information for yourself. So with that, we can't cover everything in an hour, but we do hope that we've gone over, we're really close to an hour. It's perfect today. So, but we hope it's been worth your time on this seminar. If you're interested in an appointment to come in and meet with our team, please reach out to Colleen. She will be sending you emails out after this just as a thank you. And we do appreciate all your time. Again, once again, hope it's been worth your time. And we do look forward to setting up an introductory complimentary appointment with one of our team sometime soon. So thank you.